Would you inject salmon sperm into your face? Thousands of people already are and are loving the results. I'm Dr. Sobana, a family doctor specializing in skin and aesthetics. And today we're diving into the science behind polynucleotides, the famous salmon sperm injections. Last year, polynucleotides were made popular by Kim Kardashian, and we all know how Kim K will try anything to look young and beautiful. So, is salmon sperm the new secret to younger, healthier skin? Keep watching to find out. In this video, I'll cover what polynucleotides are, how do they work, and what's the difference between all the brands, so you can choose the right product. So, what are polynucleotides? In simple terms, polynucleotides are just long chains of nucleotides, which are the building blocks of DNA and RNA. If you can go back and remember your high school biology lessons, DNA is that double helix thing that carries genetic information. So polynucleotides are basically segments or fragments of DNA or RNA, depending on the product that you use. The DNA fragments are derived from fish, usually salmon or trout. And don't worry, it all sounds a bit gross, but these DNA pieces are highly purified, and so they can be treated safely in humans. In fact, they've been used for many years in medicine for wound healing and tissue repair before it became a trending thing in aesthetics. I just want to highlight that there's polynucleotides and there's PDRNs, polydeoxyribonucleotides. And most of the time they're all just sort of clumped together. Usually it's because people don't know the difference between them, but I'm going to explain the differences in a bit. So polynucleotides usually refer to the long chain DNA segments. Polynucleotides are extracted from salmon or trout gonads or testicle DNA. They have a higher molecular weight and tend to stick around longer in the skin. Because of their larger size, polynucleotides often are more viscous, so thicker, and typically contain a higher concentration of these DNA fragments per injection. So essentially, you're getting more polynucleotide dose per injection, so it stays longer in your skin and provides a structural support for prolonged stimulation of collagen. The upside is that you get a stronger collagen boost and long-lasting effects. The slight downside is that it could be a bit more discomfort because the gel's thicker and you get quite a bit of swelling with it. Polynucleotides have even been shown to have a great anti-inflammatory effect as well. On the other hand, PDRN, polydeoxyribonucleotides, refers to shorter DNA chains, smaller fragments of the same building blocks, and is extracted from salmon and trout sperm. So they are usually in lower concentrations in the injectable products. PDRN's forte is targeting healing, so these smaller fragments penetrate efficiently and focus on repair. It's great for wound healing, scar reduction, and general rejuvenation. Many PDRN-based products also like to mix in extras like hyaluronic acid and additional vitamins, so it gives you this enhancing calm and extra hydration. Because PDRN is gentler and less concentrated, it's often suited for people with sensitive skin or those who want a very natural, mild improvement. So here's the science a bit about how these products actually work. So imagine your skin as a building, and collagen is the bricks that keep it nice and firm. Over time, we lose some bricks, the collagen, and this is due to aging, sun, stress, etc. And the building starts to look a bit saggy and a bit cracked, so our wrinkles and fine lines. So what polynucleotides do is they sort of act like a renovation team. They come in and they replace the bricks and fix the building. When we inject these DNA fragments into the skin, so it goes typically into the dermis layer, they stimulate your fibroblast production. These are the cells responsible for producing collagen and elastin. There has been some research that has shown that salmon DNA polynucleotides can activate fibroblasts to crank up more collagen and elastin, which is crucial for firm and elastic skin. So over time, this means smoother texture, improved elasticity, and even better hydration in the skin. In fact, a recent scientific review in the Journal of Cosmetic Dermatology found a significant improvements in skin elasticity and hydration in patients that used polynucleotide injections regularly. So how exactly do these polynucleotides talk to our cells? The DNA fragments from the polynucleotides bind to certain cell receptors, like adenosine receptors, and they trigger a healing response. For example, PDRN products are known to activate the A2A adenosine receptors, which boosts blood vessel growth, and so you get more nutrients to the skin, and this signals cell regeneration. This leads to increased growth factors, which can help form new collagen and even new blood vessels for better skin perfusion. Polynucleotides also seem to have an anti-inflammatory effect. They can reduce inflammatory cytokines and oxidative stress in this area that it's injected. So less inflammation means a healthy environment for your skins to rebuild. Some studies have demonstrated that these products can increase the skin's own hyaluronic acid production and therefore its hydration levels, so your skin gets plumper and more moisturized from within. Gives you that natural dewy glow. Let's talk about some brand name products that you may have heard of. We see a lot of posts on social media with various products like Plinest, Lumi Eyes, Nucleofill. So which one's best and which one should you be going for? So let's start off with Plinest. This product is an Italian product from Mastelli, and this is the product that I use on most of my patients. I really love the science behind it and also the fact that it's well tested and has very little impurities. So Polynucleotides by Plinest is the one that's kind of termed the next generation polynucleotide. It is trademarked by a new technology called polynucleotide high purification technology, meaning that the DNA is super purified and makes it a lot more safer. Plinest DNA is reportedly derived from trout, and it's purified so that it's free from proteins and endotoxin, minimizing any risk of allergies. And it comes in a 2 ml syringe containing 400 milligrams of polynucleotides. That equals a concentration of 20 milligrams per ml. So that's quite a high grade and high concentration injectable. The gel is also viscoelastic. It's almost like a soft jelly, which helps it stay in the skin and slowly release those really nice collagen stimulating products. Plinest focuses on hydration, elasticity and collagen stimulation. It's great for early signs of aging. Think of trying to improve those fine lines, the dullness, slight sagging. It's basically a general pick-me-up for your skin. So Plinest can be used typically anywhere on the body, so under the eyes, the face, the neck area, and it's also great for stretch marks and even acne scars. You have Plinest Eye, which is specifically designed for the delicate eye area. My patients that have Plinest Eye treatment regularly have really noticed that the skin under the eye becomes thicker, and it really helps to tighten the areas under the eyes. So it reduces the sagging and the puffiness that we get as we get older. There's also a Plinest specific for hair thinning, so it's definitely worth trying if you're starting to notice signs of hair thinning during menopause or perimenopause. So Rejuran is probably the most famous name of polynucleotides in Korea. It's a Korean innovated brand and it's basically referred to as baby skin injections, and it's really good polynucleotide that helps to regenerate and produce collagen. Rejuran uses salmon-derived polynucleotide, and each treatment typically comes in 2 syringes of 1 ml each, so a total of 2 ml, containing 20 milligrams of polynucleotide. That's a 1% concentration, about 10 milligrams per ml of DNA. So it's a bit lower concentration compared to Plinest, but the molecular weight of Rejuran's DNA fragments does range between 50 to 1500, meaning it has a combination of different sizes. So it's quite versatile and it can be used for different skin needs. So it's good for improving skin texture, pore size, and also for acne scars. Patients do say that Rejuran is a little bit more painful to have, so a bit more spicy when it's injected. It's because of the viscosity. It's a lot thicker compared to Plinest. Rejuran also has a variety of products for your different needs. So it has one for the eyes, it has one for wound healing and for acne scarring. Lumi Eyes is another South Korean product, and it's specific for under eye area. Lumi Eyes' star ingredient is PDRN, and it's derived from salmon as well. And it's relatively low concentration, so only about 2 milligrams per ml of DNA fragments. Each box usually has 1 ml syringe with 2 milligrams of PDRN, so compared to Plinest or Rejuran, Lumi Eyes is much lighter in DNA content. Lumi Eyes DNA fragments also have a lower molecular weight, so around 250 to 350 kilodaltons, meaning they're quite small pieces. This places Lumi Eyes squarely in the PDRN category, i.e. the shorter chains. So the selling point is that because it has less viscosity, it has the smaller size, it causes less swelling and puffiness, so the downtime is better after the procedures. But because of the fact of its lower concentration, the effects and benefit of the injection may not be as good as something like Plinest. Another brand you may have heard of is Nucleofill. So Nucleofill is from Italy. It's known as a bio-restructuring or a biostimulating gel, and it actually comes in a few versions, so to tailor for different needs. The core ingredient is natural polynucleotides and is available in different concentrations. Nucleofill Medium, which is the most commonly used product, has a 2% concentration, meaning 20 milligrams per ml of polynucleotide. Each syringe has about 1.5 ml in it, and you get roughly 30 milligrams of polynucleotide per syringe. There's also Nucleofill Strong, which is a 2.5% concentration, and there's Nucleofill Soft Plus, which is a gentler formulation for the eye area. Nucleofill polynucleotide chains are high molecular weight, so about 2,500 kilodaltons, and it's polymerized, meaning that the strands are longer and entangled, giving it a high viscosity, so it's quite a thick gel. This thickness actually gives a mild lifting effect by activating myofibroblasts and providing a bit of scaffolding under the skin. So Nucleofill is often promoted not just for hydration and glow, but also for a subtle firming or tightening. So all these products and treatments have overlapping uses for various reasons based on their viscosity and the concentration of the polynucleotide in the product. So here are my 7 top uses for polynucleotides. So number 1, fine lines and wrinkles. Polynucleotides are great for those early fine lines, especially around the eyes, so the crow's feet, around the mouth, and even on the forehead, the mild forehead lines that you get. It gives you a great plumping effect. Number 2, it's great for skin hydration and glow. So if your skin is dull, dehydrated, or a bit rough in texture, then these injections can work wonders. Number 3, under-eye rejuvenation. Polynucleotides has been a godsend for under-eye skin rejuvenation. In the past, we used to use Profilo as our main go-to for collagen stimulation and getting that glowy, dewy skin. But unfortunately, we couldn't use Profilo under the eyes. But we don't have that problem with polynucleotides. It can be used literally everywhere. The under eye area is delicate and shows aging and fatigue early. So fine lines, that hollowing, and polynuclear treatments are really helpful here. It gives you that natural rejuvenation, thickens the skin under your eyes, and helps to tighten the skin area. After a series of under eye polynucleotide treatments, people often say they look less tired. The skin is thicker and brighter, so dark circles are less visible, and those fine wrinkles are smoothed out. Number 4 is acne scars and improving skin texture. One of the greatest uses for polynucleotides is acne scar remodeling. For my patients with acne scarring, I use a combination technique using subcision, where I use a cannula to break down and separate the scar tissue, and then I inject the polynucleotide in different layers. It works like magic. It's really, really impressive. And obviously there's less downtime compared to more aggressive treatments like CO2 laser or skin ablation. Number 5, it's great for improving skin barrier and redness. So people with chronically red, sensitive or thin skin, especially in things like rosacea, eczema, PDRNs and polynucleotides are great because of their anti-inflammatory and healing properties. They really help to reduce inflammation and improve your skin barrier. Number 6, it's great for your neck and hands. We can't forget the necklines. Everyone's struggling with tech neck these days. And it's also great for the chest area. We can improve those fine lines from sun damage. And also you can improve the appearance of the skin on your hands. So one of the things that we always notice on people that ages quite significantly is the skin on your hands. And polynucleotides has been really helpful to stimulate collagen and plump up the fine lines in your hands. And finally, number 7, hair scalp therapy. Polynucleotides are now also used in hair loss treatment. Plinest and Nucleofill have specific hair treatments that can help to improve scalp health, help circulation, and potentially support hair growth. The idea is that by reducing inflammation around the hair follicles and providing a better environment, possibly stimulating growth factors, the hair can grow stronger. And it works really well when used alongside other products like minoxidil. Okay, so let's talk about safety, because no matter how great something is and however much it's trending, you've got to know the risks associated with it. The good news is that polynucleotide and PDRNs are generally very safe, especially when it's injected by a qualified person and in a clean clinical environment. Since these are naturally occurring molecules, the DNA, and are highly purified, our body typically doesn't recognize them as a foreign threat. And remember, the companies remove proteins and any immunogenic bits, so it's just a pure nucleotide chain. This means allergic reactions are extremely rare. Even if you have fish allergies, the treatment is usually still fine. But I would always advise you to discuss this with your doctor and make sure they do a patch test before you have the treatment. The most common side effects are those related to the injection procedure itself. So you'll get a little bit of redness, some swelling, and maybe some bruising at the injection sites. You'll definitely see lots of small bumps all over your face, as if you've had lots of mosquito bites. And these usually will settle after 2 to 3 days. There's no documented risk of filler type complications like vascular occlusion, since we're not using a cross-linked product. Polynucleotides are more liquid and biocompatible, so they integrate with the tissue rather than compressing it. They also don't migrate or cause a Tyndall effect. Serious adverse reactions are really rare, and there have been practically no reports of granulomas or nodules with these products in the literature. The key is purity, so always make sure your injector is using a reputable brand. If something wasn't purified well, in theory there could be a reaction, but that's why you always stick to proven licensed products. One thing to keep in mind is these injections stimulate cell activity, so results take time and vary. If you're expecting a dramatic change overnight, then you will be disappointed. It doesn't quite work as fillers, where you go in, have the treatment, and you see that immediate wow effect. Typically, you see improvement gradually over weeks as the collagen builds up. And you usually need a series of treatments. Most products recommend 2 to 3 sessions, usually 3 sessions, about 2 to 4 weeks apart, and then maintenance treatment every 6 to 12 months. Skipping out early might yield only subtle changes, and that's when people end up saying that the product was rubbish or didn't work well. I always compare it to going to the gym. One workout doesn't give you abs, unfortunately, and one collagen stimulating treatment won't erase all those wrinkles. But keep being consistent and give it time, and you'll notice the transformation. Finally, just remember, make sure these injections are done in a clean medical environment with sterile techniques to avoid any risk of infection. And there you have it, a deep dive into the world of polynucleotides and PDRN. If you've been thinking about having these treatments, I hope this video has answered some of your questions. Remember, always consult with a qualified practitioner who can recommend the right product that fits your skin needs. And sometimes you might need a combination. The key is managing your expectations, and remember, consistency is key. I find these injectable treatments quite exciting because it really provides a natural way of stimulating your body's own healing processes, stimulating your natural collagen stimulating pathways. It's smart skincare at a cellular level. If you found this video helpful, feel free to hit the like button and subscribe for more skincare advice. Please pop any questions in the comments below, and I'd love to hear your thoughts and experiences with these salmon sperm treatments. Until next time, stay glowing and take care of your skin.